physician-computer company. PCC empowers independent pediatricians, streamlining daily operations and improving financial stability. A trusted pediatric partner for 40 years, we offer award-winning support, personalized training, seamless data transitions, and practice analytics. With inclusive pricing, a lively peer community, and a free annual users conference, you can focus on what matters the most, your patients. Explore more at pcc.com. That is pcc.com. Pediatric Executive Development System, or PEDS, is a dynamic, transformative program designed to accelerate the growth and development of the leaders in the field of pediatric entrepreneurship. PEDS takes a hands-on approach to problem solving, addressing real-time situations within your organization. More than a theoretical course, it is a practical platform that accelerates learning. Look at our link on the show notes for more information. Hi, George. It's Thursday afternoon, and we're all in different parts of the country today.
As usual. Well, today we have Dr. Adam Breslow, and he's going to talk to us about an interesting topic. What do pediatrics look like in San Diego? Welcome.
Hi, it's great to be here. Nice to meet both of you.
Yeah.
Dr. Adam Breslow is the CEO of Children's Primary Care in San Diego, and we met through one of his colleagues and fellow podcasters, Dr. Wendy Hunter, who's the host of the Pediatrician Next Door. We're so excited to have Dr. Breslow on the show to tell us what a supergroup looks like on the other end of the country, on the West Coast. Dr. Breslow, why did you become a pediatrician?
It's a little embarrassing being called a supergroup, but thank you for that. From your question, there was no medical anything in my family. My father was a schmata salesman, Yiddish for the rags of clothing in the garment industry in Manhattan. My mom, who's still alive, was a New York City educator. She was a special education paraprofessional. We lived a very middle-class lifestyle. And at age 10, I just knew I don't know why I knew, but I just knew I was going to be a pediatrician. I've been drawn to the most vulnerable people around. I really wanted to take care of other people. And it's just really fun being around kids that generally a kid at heart. I have not particularly matured in my almost 63 years, and I couldn't imagine any other job. I had no plan B. There was no plan B. Luckily, it came to fruition, but there was no specific reason other than it's just in my DNA for some reason. So that's as good as I can make it at this point.
So it's the American story, isn't it? You started with a dream and came from middle class and came up through the ranks through Rochester and into San Diego, and then lead many pediatricians in many different offices out there.
Yeah, but I had no dream of being in San Diego. And in case you don't know it, it's a pretty nice place. If you haven't visited, it's a lot of people do visit here, and it's an awesome city. But my actual dream was I went to college in Philadelphia, and all I really wanted to do was to stay in Philadelphia. I loved Philadelphia, nice East Coast historic city. That said, I was on the wait list for my dream school, and I did not make it off of the wait list. I then had my plan B was to go back to New York City, and I was matriculated at Albert Einstein. I was accepted at Albert Einstein, and I went to high school at Bronx Science. So I had a lot of familiarity with the Bronx, lots of friends there. My whole social structure would have been either in Philadelphia or New York. And then at the last minute, literally the last minute, the University of Rochester, which was funded by Eastman Kodak, when film cameras were actually a thing, gave me this incredible scholarship that was just too good to pass up. So at the very last minute, I went from wanting to be in Philadelphia to having a room. I already had my room paid in the Bronx, and I took off. I didn't have any place to live in Rochester. I ended up living on someone's sofa for the first year as a medical student. That said, I showed up and they gave me too much money. I went to Rochester. Once again, back as a kind of middle-class person, I could only afford so much. So I went, had to follow that money. Rochester's a really nice place. It's a very pleasant town, and the academics were outstanding. That said, back in the day before global warming was a thing, it was really cold, and it's not a place necessarily for a young single guy. So I dreamed of going somewhere else. So I want to go back to Philadelphia, and that dream also got busted. CHOP is the hardest residency program in the country to get into, so they didn't accept me. And I just ended up wound up here in San Diego. That was not by design. That was just random good fortune more than anything else.
Oh, wow. What a wonderful journey.
Well, it's been pretty nice. I got married here, have kids here. All the other stuff happened out here nicely. It all fell into place.
Oh, wonderful. How wonderful. And now you are the CEO of a big group, Children's Primary Care in San Diego. How many clinicians does the group have?
Yeah. Our official name is Children's Primary Care Medical Group. We abbreviated CPCMG. We have a million acronyms for various things around here. We started in 1995 with 27 clinicians, 26 doctors, and one nurse practitioner, 6 practices, 9 offices. And as of right now, we're at 28 offices with 164 clinicians, 2 more coming aboard. We have 26 nurse practitioners and 3 physician's assistants. Everybody else is physicians. And we take care of about 280,000 patients. Our patient base is the size of a U.S. city. And we have just under 600,000 visits. We're at about 560,000 visits a year for the group. That is pretty big. We started very modest, and we've grown dramatically over the years. We're in 2 counties now. We're in both San Diego County and in Riverside County, which is the county directly northeast. North of us is Orange County, which is the OC, that kind of thing. We've stayed out of that, but we went into Riverside County, which has really been one of the growth areas of childbirth in Southern California. So we moved into that area. It's a big city. Okay, you keep calling us that, but I like mentality. We try to have a pretty good family mentality as go.
And you have a great relationship with Rady Children's
Yeah,
Hospital?
we're part of something called Rady Children's Health Network. I have the pleasure of sitting on the board of Rady Children's Hospital, so I get to hang with all of the muckety-mucks who run that. It's an amazing institution. But Rady Children's Health Network is an integrated delivery system for which we are part of, like I said, the acronyms. We're part of CPMG, Children's Physicians Medical Group, which is our IPA, which is the contracting arm for RCHN, Rady Children's Health Network, which is the integrated delivery system. And that we are what's called a tier 1 provider. We're fully integrated. We're integrated both clinically and financially. There are a number of other tier 1 providers. So we're about 80% of the tier 1 RC patient base. And with that, we get to interact quite a bit with Rady's for quality programs, for access programs, for social programs. It has been a mutually very beneficial relationship. And I think we love them. I think they love us. I'm pretty sure I think I can say that. But between the specialists, the primary care, the hospital, then all the ancillary services, we shockingly get along really well. It really is a model for other integrated delivery systems. But we're all kids all the time. Yeah, it's all.
How is your corporate structure?
How is it? Excuse, what's structured?
Your corporate structure. Are you guys know outside email matter?
Thankfully, that's some of the questions are going to be, this is a secret sauce. This is a personal secret sauce. CPCMG is physician-owned, physician-governed, physician-managed. So we are affiliated with RCHN. We're affiliated with Rady's. We're not owned or governed by Rady's. Our group was founded by one of my mentors, Dr. Leonard Kornreich, who was very entrepreneurial primary care pediatrician in the South Bay of San Diego, and really believes that physicians do know what's best for patients and patient care in a very collaborative fashion. So we are very kind to our partners, whether our management team partners, but CPCMG is a medical professional corporation. We have a management team through a management service organization called Rady Children's Physicians Management Services, RCPMS, and they are owned and governed by Rady's. So our management team answers to Rady's, the medical group answers to the physicians of the group. And it too has been a very symbiotic relationship. We are one of the really high functioning management service organization, medical group dyads, I would predict, in the country. I go to enough conferences and I hear all of the bad stuff that goes on with people. I go, we don't have any of that. So I never understand why we have to fight so much. We just work together. I think it's a really great paradigm that we put together.
You
I
guys
think
still have partner physicians or somebody organization? That's what.
Well, we're kind of both. Everyone's an employee, myself included, but we have a shareholder track of our physicians. Right now, 101 of our physicians are shareholders or owners of the organization. And that's been quite the journey. When we first started, only the original founding clinicians, the founding physicians, were shareholders. I was just an associate physician for many years. And as we've developed over the years, we have associate physicians who are either on the shareholder track if they meet their criteria, or they're off the shareholder track, and that's usually by FTE status more than anything else. Then our nurse practitioners and our physician's assistants are all employees of the corporation.
so. I think we talked to a lot of people across the country, and they all share the same secret sauce. One is physician led with a strong partnership with strong administrators, and two is a strong culture of people first, patient first, doctors first, and finally relationships. The ability to maintain the relationships within your partners, with the children's hospital, with the community, with your patients. And it seems you're really doing all of those on steroids.
I would agree with that statement. I think there's a few other secret sauces coming from our end, but one of our other mission oriented, we take care of everybody, that we are the largest single safety net provider for kids in a single medical group in California. 43% of our patients are Medicaid. So it really helps. We're in every community. We're very diversified. We have commercial HMO PPO. We have Medi-Cal HMO PPO. We have TRICARE. We have a few. We love them as well. Cash pay patients. They're always welcome. And when times are good, we've done well with our commercial fee-for-service patients. When times aren't so good, our capitated patients keeps the income flowing. Our diversification and being really, we've led the way for decades with DEI type work. We've been inclusive for all payer mix for the entirety of our organization. We're very proud of the fact we don't turn anybody away. The only caveat, we turn Kaiser patients away. So we do turn them away. But for the most part, we don't turn anybody away. You want to see us, we're happy to see you. And we bend over backwards. My personal office was in a town called Chula Vista, isn't a town, but that just a few miles from the Mexican border. I saw hundreds and hundreds of patients who would cross the border from Tijuana to come see me, and happy to see them as well. They didn't have to be even American citizens. Happy to see anybody who wants our care. If you want to come, and we come, where we're happy to accept any and all comers.
Have you ever thought about expanding outside of California?
We thought that the answer is we can think of a lot of things. Our group, though, with all of our success, is still pretty young. We're coming up November 1st is our 28th anniversary. And times have not always been so great at here. The first decade was putting together all of these disparate 3 to 6 doctor practice groups together. And we were a group of practices. It's only been in the last 12 to 15 years that we've become a group practice. So we're still finding our way, and we're not quite ready to have that type of grand vision yet. But we've thought it's been in the discussion, but no, that's not really our thing at present time. We're going to stick. California's nice enough, and we're doing well enough. We need to still mature. We're still in our late adolescence and a medical group. We are not mature enough right now for those kind of grander visions.
Now, you seem to be targeted for takeover and flying out and I take your see them knocking on the door every other.
Well, not every other day, but they know our email address. They know my email address, and I do get contacted. I'm gonna have to leave it at that because it's been an interesting journey when it comes to when people come and knocking. And our group currently, we really want to continue our path to excellence and do our thing. And once again, we're not quite ready for anything other than being the best medical group that we can be. And so that's our focus.
But sure, if you continue with that, you think about it, any group that anybody really is a practice that's worth keeping, I think.
So that's almost exactly what was said by my board of directors. We are just going it by what we're doing right now, and we'll see what the future brings. But I'm not predicting that far down the road.
How do you manage so many offices and so many people? There's got to be so many personalities in your family.
That's my favorite question of all the questions you sent me. So thank you. I don't manage anything. We just last week or 2 weeks ago celebrated, my wife and I celebrated our 31st anniversary. And I don't manage anything at home. I don't manage anything here, but I married the best wife and I hire the best people. We have the most incredible group of both clinical people. We have not had any significant litigation against our group from a medical standpoint in 28 years. This is just our insurance carrier keeps telling us we have the lowest rates in the country. And I won't say what they are, but they're insanely low. Our current malpractice insurance is 20% of what we were paying 28 years ago. So we're paying without inflation, anything like that. We're paying 20 cents on the dollar for malpractice insurance compared to 28 years ago because we have such a great claims history. So that's part A. Clinically, I mean, I just hire amazing people. They all seem to come to California. So when I interview them for behavioral questions and for behavioral skills, so we have a lot of well-behaved clinicians, which is not the standard in many medical groups. And then we have a really nice administrative team. I have an executive team. I tell him all the time, and he gets embarrassed all the time. I do have the world's best chief medical officer who is just beyond beloved, and people follow him to the end of the earth. We had what's called the chief medical informatics officer, who we just promoted to a chief digital officer, who is beyond brilliant. I have an amazing management team. We have a middle management structure with each office having a lead physician who helps manage their people. My partner in crime at our management service organization, we have a great relationship and they take care. So the physicians see the patients, the management team does everything else. And I just sit here and talk to you. No one ever wants to believe me. Once you hire the best people, the other secrets are leave them alone. Let them just do their thing. You don't have to I think people would say, honestly, I don't micromanage anybody. They're too good. They wouldn't want me getting in their middle of their mess. They're so good. I just leave them alone. And we produce great stuff. If they foul up, which is virtually never, but when they do, I give them some gentle feedback. But other than that, I just sit here and talk to you guys. I'm happy to do that. Excuse me?
You still see patients?
I still see patients, and I'm a really good clinician. This is my seeing patients. So it's my happy space when I see patients. One of the things that happened, and if you didn't ask on your question list, do you have any regrets? But I don't have many regrets. But one of the regrets is that I gave up I had a very large patient panel size practice in the South Bay. I had probably somewhere between 600 and 700 second generation kids. I loved my practice. I lived for my practice. But when I took over this position 8 years ago, I gave that up. And what I pledged to do every Monday, I would see patients at a different office of the 28 offices. I'd go to a different office and go around the system and seeing patients. When COVID hit, I had to stop that a little bit because nobody wanted me coming around to their offices. So what I do now is we have after hours clinics, we have evening clinics and weekend clinics. So I do a lot of shifts there. And when someone goes on maternity leave, I tend to fill in for them when people are on maternity leave. So I can go to an office for a month or so and help fill in for some open shifts and things. But I still see patients 0.2 FTE, but I gave up my true primary care practice 8 years ago. And if I could have somehow kept it, I would have. It's hard to do that at 0.2, but I still see patients, and I have yet to ever leave the office after seeing patients be grumpy. I'm happier I'm one of the few people, I'm happier when I'm done seeing patients. Go, oh, that was a great shift. And one of the things I ask as I go into the shift, because I'm always meeting new medical assistants, new front office staff, new LVNs, I say, what can I do to make this the best shift you've ever worked today? I want you to leave here and say, this is the best shift. And usually at the end of the shift, was it the best shift ever? They give you the, whatever, I don't know. But the reality, every once in a while, I go, yeah, that was a really good shift. I really enjoyed it. Thanks. So my job is to help the other people have a good time seeing patients. That I really enjoy doing that. And
Why didn't that practice follow you?
once again, it's a primary care practice, pre-scheduled. I go all over the place. I'm at 28 sites. Every once in a while, I'll see one of my old patients and stuff. But the reality was I was anchored in my office overlooked the hills of Tijuana. Most patients are not going to the far northern end. San Diego is a pretty big place. Out in San Diego up to Oceanside is 65, 70 miles. But no one's going to drive. In case you don't know, it's a lot of traffic.
Yeah.
Not going to come through 140-mile round trip to see me. I mean, I'm good. I'm not that good. So,
Do you have a chief wellness officer?
yes, we do. And I just spent the last 2 weeks with her at various conferences. We went to ACPH, the American Conference on Physician Health, run by the American Medical Association. And we just finished up at the AAPNCE. I know, apologies for not connecting with you, but I took every class. Her name is Dr. Genevieve Parsons. She's just recently become our Chief Wellness Officer. She was our Director of Wellness for 7 or 8 years, and she was the chair of our Wellness Committee for 10, 11 years. So we've been in the clinician wellness space for a long time, but as the last few years have proven, we've needed to put more resources into that. We've really beefed up our wellness program. We were awarded the silver medal from the American Medical Association for clinician wellness. So we were in Palm Desert to accept our award because of the great work that she's been leading.
Wow. And what do you think is the biggest, most important role that you play for your group? Is it building culture or simply just, as you said before, hiring the right people and let them be superstars?
Yeah, more the latter. A secret for, I guess, I don't know how many people listen to you. I was not always the best behaved clinician, and I was not always fully positive all the time. And I was like young, grumpy guy who I can't wait to start taking things over type stuff. I've really learned over the years extreme patience for processes and procedures. And obviously, if a kid is bleeding in front of you, I jump all over that. Kids not breathing well, jump all over it. But from administrative processes and wellness and from building all of the things that you need to build, the most important thing is to be patient because people just want to know you have their back. They want to know that you care about them. They want to make sure that you are moving things forward. And then when you do hire the right people, they carry on that torch. Most of this has been it's not been the steep rise of anything. It's just been the slow, steady movement to clinical excellence, to operational excellence, to cultural excellence, to wellness excellence. It's a slow, steady rise. I'm a long distance runner and I don't know how to go fast. I don't know how to do anything else except go in one direction straight. I take the principles of long distance running, which is just build a base and just keep practicing, keep training until you get better at it. I can still run. I still run half marathons and I can't do marathons, but I can do half marathons and I go slow and steady and I still can do it. That's the general philosophy on that.
Yeah, those are wonderful thoughts. Is there a course that you took for patience and to get the grumpiness out? Because George and I might need it.
Literally like that. The other grumpy, I'm that lovable guy that everybody loves.
My father, who worked on the Schmatter, he was basically Archie Bunker, if you remember who Archie Bunker is.
Yes, absolutely.
He was Archie Bunker. Maybe one step, he was a Jewish Archie Bunker. But that said, got bitter as the years went on, really have focused on just, and it really comes, I'm not jealous of what people have. I'm just happy with what I got. But one of the things that I really believe more than anything else that will help any organization, does not be medical, is have gratitude for what you do have. Don't worry about all the things you don't have. I live in a very modest house. I drive a very modest car. As you can tell, I wear very modest clothing. You too, I can't tell Dr. Herb, that could be an expensive shirt. But Dr. George, I'm sure it's not that expensive a shirt. That being said, I believe in modesty. I believe in living modestly and dressing modestly. So I don't worry about those things. So
See, this is a very personal question. You can tell me none of my business. Do you meditate?
not at all. I've been told I should do that much more over the years, but the answer is I don't necessarily meditate, but I run a lot. So when I run,
Yes.
I zone out and it's not formal meditation or anything, but I still to this day exercise 7 days a week. And when I'm exercising, I just don't worry about other things. I just get in the zone of dealing with how my body feels and whatnot. So,
Yeah, that psychologists call the flow state. And you can feel it. I'm not a good runner or jogger, but once you get past the first mile, you get into this flow state where you're no longer thinking about all your other things you have to do, but you're just thinking about your pace and your breathing and how you're doing. And it's incredibly enjoyable.
I
Um,
don't quite get the runner's high as much. But if you haven't been to San Diego recently, the one thing, if you're a runner, some of the worst paved streets in the country. So you do have to focus on where your foot is going to fall because it's not uncommon to jog into a very deep pothole. You have to be a little bit present and keep your eyes in front of you. Otherwise, you can really get injured.
and as a business owner of a pediatric practice, what do you think are or is the biggest challenge to
Yeah.
our financial viability?
I don't think that there's anything unique to us. And when I go to these conferences, it's the same everywhere. But number one is staffing. When we're fully staffed, the day goes in a way that just doesn't go when you're not fully staffed. And the biggest challenge is keeping our staff engaged, keeping our staff well paid well enough so that they want to stay with us, getting good enough benefits, treating them like respected colleagues and not treating them like they're your servants or anything. Physicians do tend to have a different
Understanding way.
to work with. The physicians who are able to treat their staff like exalted colleagues, they stay a lot longer and the staffing is better. And then number two is just the focus on clinician wellness, that people are hurting out there. And I get to hear, for better or for worse, some of the difficulties. But physicians, we've had spousal deaths, we've had child deaths within our organization of our clinicians. We've had horrific family problems with accidents and injuries and illnesses. We've had financial problems. We have a lot of things that go on in people's lives that does not let them be the best in the office. And we have to help them through it. And then the office doesn't necessarily help them be any better. So we really have leaned into giving as much support as we can. We've built something over the years called TLC, Talk and Listen Confidentially, a program of 10 of our clinicians who just someone that you could, just talk to and non-judgmental. They don't give you any advice. They just listen to you for things. We have a very active wellness committee. We have very active programs we have what's called regional wellness champions to get out there and to really be with their teams, to know that we have their back. So between staffing and wellness, we make enough money. We're not going to go bankrupt. So what we really need is just for the stuff we do to get paid for.
What I was going to ask you, I don't mean to interrupt you, but yes, we all would hardly any pediatric practice can hire an RN anymore because of the cost. At least the Medicaid program in Virginia is not a very well-funded one. It's worse in New York. Two of the worst programs for Medicaid are California and New York. And how do you recruit all these great people and keep giving them the things they need in expensive neighborhoods when we're constantly being nickel and dimed by health plans and managed care organizations?
I'm sure we'll keep the secret over here. But number one, in the last few months, we've hired 9 RNs. We have an amazing management team who knows how to treat their people. The RNs are part of our management team. We do pay market-based rates, and people like to be part of the integrated delivery system. But that said, I'm trying not to give away anything too much proprietary on this one. That diversification that we talked about, and I know you talk about how Medicaid's been very good to us. In California, we have Prop 56, which bumps us up to Medicare rates. We've gotten lots of benefits from the ACA funding over the years. We've gotten lots of benefits from the high-tech funding over the years. But we do the work. We deserve every penny that we get. But the secret sauce is you can actually do pretty well on Medicaid, but you got to do the work. And we don't complain about it. We just do it. And then, fortunately, both our federal and state government has been very good to primary care in the Medicaid space. And most of our competition don't do any Medicaid. And so when nobody was showing up during COVID, they got nothing. We got a lot, even with that. I would caution you to think that one of the things I believe wholeheartedly, if everybody in this country, especially every pediatric clinician in this country, even took 10 to 20% Medicaid, we'd be a way better country health-wise, and you'd be okay. You'll somehow put food on your table, you'll drive a nice car, you'll have a nice vacation, you're not going to starve, but it comes back to that whole gratitude. I don't worry about that I didn't make the highest amount ever humanly possible. I live perfectly fine. I don't need to be Bill Gates. I'm not going to be Bill Gates.
Yes.
On the Medicaid space, if you're committed to it.
Yes.
100% of Medicare for Medicaid line of business, that's really good. A lot of states are.
So
56 does for you. Yeah.
Yeah. So we are not as lucky. In New York, they are at 45% of Medicare, which makes it really difficult to run a practice 50% Medicaid when you're only getting paid 45 cents on Medicare. In Virginia, is a little bit better. It's only 73%. So it's very state dependent. Not that we're looking to get rich off of the Medicaid patient, but when you're getting paid $45 for an office visit, like you are in some practices in Rochester, it's not sustainable. It's not sustainable. You're losing $20 every time you see that patient.
I want to be clear. We're not 100% Medicaid practice, and we had our first 15 years at the 45%, and we still managed to work through that. but that comes with the diversification. We have really good contracts for our commercial patients. We have good HMO contracts, good TRICARE contracts. I don't want everybody doing it. It's not right. Unless you're a FQHC, doing 100% Medicaid is a death sentence, but 10%, you'll still be fine. And the kids
Yes.
get good access and you'll be okay. And yes, you'll be doing good for the world. And so we're at 43% Medicaid right now. But we've been pretty steady at that now for the last decade or more. And we were doing that before Prop 56, before all the other ACA enhancements for the people who went in the Medicaid space. We've still been okay, but we were very modestly paid. Now we're better than modestly paid for it.
The
But you're,
Medicaid of the businesses, they tend to flock towards those big groups and have a lot of their patient base. They can work with you a little bit more, give you a little bit of an enhancement. And we had a couple of people that are completely medicated, like the businesses and the offices, and they're doing pretty well.
Yeah.
55%.
I'm assuming you do, that you can pay your pediatricians well enough that they can live in the San Diego area, not like Bill Gates or on what's that? What are those fancy beaches that people look like? La Jolla is very beautiful, but not that kind of multimillionaire, but enough to be able to live decently in a nice house and in a nice county that the district is good for your kids' education.
So personally, I live on the last block of San Diego. I am the furthest east of San Diego that you can call yourself. The next one is the first town over called La Mesa. So I'm officially a San Diegan, but I live as far from the water as anybody can be. That said, yes, our clinicians can own homes. They can absolutely raise their kids nicely and take vacations. And then they can decide what they want to do. If they want to invest their money or buy real estate or buy stocks, they can do whatever else they want. They could buy the biggest house that they can afford, or they can have a modester house, a more modest house, and then choose to invest their money however they wish to choose to invest it. But well, we've done our best to make sure that people can afford to live. But it's still the staff. That's much more difficult. They struggle to live. We're in every community of San Diego and Riverside. We have an office in La Jolla. The staff, our doctors actually mostly live in La Jolla who work in La Jolla, whereas our staff who work in La Jolla, they don't live anywhere near La Jolla. And that becomes a real equity issue and how to attract staff to want to travel that far. And it's a lot of traffic to get in and out. It's a very narrow road to get in and out of La Jolla.
La Jolla is beautiful. I visited there once and I'm like, I don't think I can even afford to buy dinner here. What am I doing?
You can afford to buy dinner. Yeah.
I did, but it is beautiful.
Find you a dinner spot in La Jolla. When you come out, I'll be happy to have you treat me to dinner in La Jolla. You'll see.
I would, and that would be my pleasure.
Yeah, that'd be great.
It is a beautiful town.
Correct.
What key performance indicator do you watch? What do you think? What's the pulse that you keep your finger on to make sure everything's going okay?
So all I would ask is key performance indicators. A little bit.
Okay.
Number one is all the quality. The bottom line is quality. Our group is accredited. We're accredited by AAAHC. So we're accredited for a full primary care medical home model. So with that, we pay attention to our HEDIS metrics, but specifically the ones surrounding the well child visit, the combo 10, as well as the access for visits, birth to 2, and then from 3 to 6 and stuff. We know that once you have access, then our clinicians do such a great job, you're going to get really top-notch care. We do believe that HEDIS metrics actually will enhance the lives of our patients. From the business side, the metrics is basic productivity, visits per session, and access to your third next available. And then from our wellness standpoint, we partake in the AMA wellness survey. So the global burnout rate is really what we look at. And we've had some of the lowest burnout rates in the country. It went up significantly last year, and it's dipped down quite a bit this year. So we take burnout amongst our clinicians very seriously. So Those are the three basic areas that we look at.
You're the first.
Yes, I'm curious to ask you. You said the number of patients in a session. How long is the session? And how many patients are generally seen in the session?
That our sessions are 4 hours, it's 3.5 hours of scheduled patients for 4 hours of total clinical care time. That said, we have 20-minute physicals and 10-minute sick patients. For adolescents, the clinicians can choose between 20 or 30-minute physicals for adolescents. For patients, we have a proprietary, it's really amazing. We have this proprietary risk and resource tool that we've built into our electronic record. So if you score high enough on the risk or the resource needs, you can extend visits for mental health visits or things like that to have longer patient time. But a standard template, if it was just like clearly, blank, would be for 14 patients per session, of which 6 or 7 are checkups, well visits, and 6 or 7 or 8 are for sick visits. We've really pivoted into mental health quite a bit, so those are longer visits. But the reality is, our average clinician, despite whatever the template is, sees about 11 patients a shift. So about 22 patients a day, which we have some who do.
It adds up to more like 28.
Excuse me?
It adds up to like 28.
The spots are available for 28. It ends up actually being about 22, 23. We have some who see in the 30s. We have some who see in the teens. But on average, the average clinician at CPCMG is about 22 to 23 patient visits per day.
What was the other metric? The next third?
Third next available. So when a patient calls up, I want to see Dr. Breslow. Oh, you can see him next Tuesday it's for check. It's for well visits. You can see him next Tuesday. Okay, I don't want that. What's next? You can see him 2 weeks from next Tuesday. Okay, what's next? Then the third next available is the industry standard for access, and it's supposed to be less than 30 days. And that has been a bit of a struggle with the COVID rebound, but we do our utmost to try to get the third next available to be reasonable. The problem is if you're a really popular doctor specifically and you have a big panel size, it's really hard to get to 30 days. But some are more, some are less, but the longer we're out, the more we look at resources. We've been doing all kinds of things to try to access patients through video visits. We've been trying to access patients through a population health program by getting them offloaded to those 9 RNs that I've talked about that we hired to get them their needs met, to make sure that we can meet our access standards for the well visits.
Dr. Wendy Hunter shared with us, she has the typical path of most physicians today. They go work for a health system and they're not treated with any kindness. And within 7 to 10 years, they're pretty much burned out. And some of them is just outright quit. Others go to work for tech companies. But she's a huge fan of your system. And her part of her recovery was to come and work for your group. And she tells us in the podcast what a difference it made in her life to change from her prior employment to come to work for your group. But I wasn't aware of how much emphasis your group puts on physician wellness.
It's in our DNA. It's part of our strategic pillars. I have to answer to my board of directors with all of our wellness programs. So it's really important that we get that done. That said, yes, she is one of the most grateful, gratitude-filled people in the history of this world. And it's hard to not be happy when you're around her. And I'm not sure if she told you, but she was an ER doc by trade, and I could to not hire her.
Oh, she didn't tell me that.
It's embarrassing, but she was so over the top about wanting to come to work for us. I said, you're an ER doc. You'll never be satisfied in primary care. But the reality is she was able to pivot to primary care the best I've ever seen anybody do it from any other profession. I even hired someone a couple of years ago whose mother is a local family practice doctor who works with a very close friend of mine. He's a neonatologist by trade and was having some issues getting a job in neonatology. He joined us. He gave up neonatology after all his years of training, and he's the happiest he's ever been working with us as a general primary care pediatrician in a very low income part of town. So I don't know what the exact source of all that is, but we do focus on wellness. We do focus on every one of the people who works for my executive team and my management team is told one thing. We serve our people. They don't serve us, we serve them. So they reach out to you for something. It's what can you do for them? What can you do for your people? And if you expect them to just do stuff for you, you're spoiled. Get out of here. So I've had to let a few people go from my management team over the years. Not many, but when it's all about them and their needs, they are not appropriate and they leave. They either leave the organization or they at least leave their management structure. But we're pretty good about giving feedback. I would say that's, I'm good. I'd like to get to great on that. I'm not great at it, but I think I'm better than most, but I'm not where I need to be. But you have to give people feedback. They have to serve others. And if they're selfish, it ain't going to work.
So it seems like you got culture and everything. I'm curious to hear about your infrastructure and technology. You have a good system. You're not death by 1,000 clicks system.
We have a great system. We still have death by 1,000 clicks, but every week we get 1 click less. Since, like I mentioned before, one of the people I work with, Dr. Michael Jacobson, is our chief digital officer. Just like we have the best CMO in the country, I believe we have the best digital clinician. He sees patients still, and he has a vision of how to make the electronic record work for you, to make all the digital programs work for you, help build our video visit program, help build our cockamamie patient reminder program, which was awful. Now it's amazing. Help build our digital tablets and help build the patient-entered questionnaires. So when you come for your visit, you just basically are put in a room and the doctor can come see you right away. You're not sitting there filling out 100 forms because we have a really nice system that lets you do all the work ahead of time. The clinicians barely have to chart because the patients do all the charting for you with the patient-entered questionnaires. Once again, I didn't do any of that, but I gave them freedom to explore doing those things. And we're looking into something right now called building a digital front door and really having a true comprehensive system for which any patient can access and do all the self-scheduling they want, get all the forms they want, get all the information they want, get all the access they want, and not have to have the barriers of waiting on hold for 20 minutes to talk. But if you need to talk to somebody, you can do that too. We have a great relationship with the hospital because the mothership, which is Rady's, is the main contractor for our Epic services. Then we have an amazing relationship with our management service organization who helps do the day-to-day infrastructure. We really have a nice triumvirate of people who get to work on making it work for our clinicians. It has a long way to go. I mean, believe me, we have burnout in our organization and we have people who complain about their in-basket. And we have people who complain about too much charting and too many clicks, but they know that we're doing stuff about it. We're not just like saying nothing we can do. Sorry, everybody, just deal with it. It goes back to your comment before of just your nameless, faceless thing within a corporation. The corporation is the clinician. We take care of each other. We try to have each other's backs. And the management team, literally the executive management team, if they don't do that, they don't stay around very long.
So let's listen to Dr. Wendy Hunter, a pediatrician, podcaster, rum player, and avocado farmer in La Jolla, California, as she describes on our podcast what it is like to work for Dr. Breslow and his executive team. Don't forget to listen to Dr. Wendy Hunter's podcast, The Pediatrician Next Door, on Apple or wherever you listen to your podcast. You love going to work.
As much as a pediatrician possibly could, yes. I've got it as good as it gets. It's a hard environment to work in, right?
Yes, but it is 300% better than you are in the health system.
Oh, so much better. And I feel like if I need something, someone cares and wants to make it better. And having that control and that hope makes all the difference.
This is the first time I've ever heard of an outpatient physician say a good thing about it.
I can guarantee, I 100% guarantee. If I said everybody tomorrow, go back to paper charts, not a single person would say I want that. Epic is really good. And everyone actually likes it except for the stuff that they hate. Everyone has something within Epic that they don't like, but we have a good relationship with our hospital, with the Epic team. They come out here, we meet with them. We're constantly trying to do improvement on things, and people recognize it. And what we do really nicely is we have a really excellent training program. We have something called super users. And so we teach the super users to teach everybody 1 or 2 new techniques a week that can help you be more efficient or chart less, be home earlier, things like that. No one likes electronic rec. There's not a single person who says if it didn't exist, they wouldn't be happy, but they're not going back to anything else. And there's nobody in our organization who's asking to go to other electronic health records. And it's the best of
But
the
this your instance of Epic is your organization's instance of Epic, not the hospital's version.
We're private integrated delivery system. So yes, it's called the Rady's instance of Epic.
Right. Make the approval for a change.
That if it's in primary care, we tell them what we need, and we have a great relationship with their team. They have not let us down. If they tell us we can't do something, they give us, here's why. And as long as you give us a good why, we're cool with that.
In the hospital, what usually happens is if a physician has a good idea, they have to go through a bunch of hoops, need to explain why you want it at the medical doctor level. Then you got to get to the IT people.
Yeah.
Usually medical doctor level.
Really in our conversation, we have a great relationship. I don't hear this with other people that I meet around the country. I have regular one-to-ones with the Rady CEO. I sit on the Rady board. The Rady family knows who I am. These are multi-billionaires. They actually like CPC. They're happy to work with us because we take care of them and they take care of us. And I don't know if we're unique in that respect or not, but we have a great relationship because we worked at it. And we've had great leaders in the past who did not burn bridges. They didn't go with pitchforks that we're not getting our way. They built bridges, and it's closing in on 30 years of good relationships, and it's paying off. Nothing of this happened overnight. I am not responsible for any of this, but I am responsible for carrying the torch to make sure I don't screw it up. My number one fear was like, oh my God, I'm going to screw all this up. That was my number one fear. And I've had a couple of close moments over the years, but for the most part, we carry the torch of we want to honor the past and then look forward to continuing a great relationship. It's not in our interest to fight against the system. We work with them, and maybe it's unique to us, but the Rady administrative team is so incredibly friendly to primary care. I don't know how to say it other than the fact that they trust us, we trust them. They're really friendly to primary care. So why do I want to screw that up? I'm not going to worry about if they didn't approve one thing we asked for. Okay, if they approved 22 other things we asked for, so be it. Why make a fight over that?
I think you're an outlier. There's other hospitals like Nationwide in Columbus, Ohio, and Dr. Bill Long, who's been on the podcast. They have a very symbiotic, respectful, professional relationship with the Children's Hospital. And Dr. Caronia, I think, in Long Island. What's that hospital called, George?
Samaritan.
Good Samaritan. They're mission driven. They take care of everybody. They see the community pediatrician as an extension of their walls, and they see the hospital as a honored and privileged to take care of the patients that the neighborhood physician sent for care. There are other systems that are cutthroat and they're multi-specialty and not just pediatric focus, and they're no longer mission driven. And those are more difficult to work with. Anyhow, please remind Dr. Hunter that she promised to send me some coffee beans from the farm. I have not seen him yet. I love my coffee in the mornings.
She has it's an avocado farm as well. So
Yeah, but I
unripe, they'll ask her to make sure.
told us that you're really genuinely integrated, which was the first group. So most groups your size are groups without walls, and each office is its own cost center, and their profit is what they get paid. And she said your model was very different. That when one office is not doing so well, the other offices pitch in to make sure they're okay for that year.
The first
That's
was
the first
our model. That was our model. Back,
group without walls.
yeah, up through 2008, that was our model. And the reason I sit here today, we used to have every office was its own profit and loss center. I worked on the Mexican border, not the highest paying patients out there. So I was making less than half of what other people in our group would be making, doing this either more or the same work. So the motto is, and this started in 2008, patient as a patient. And we all have to agree that if we're going to be a group, CPCMG, that we're going to have to share in the good times and the not good times. We have offices in the lowest income portions of San Diego. You could not attract somebody there to be paid half of what someone else gets paid somewhere else. So I came up with the patient as a patient as a patient. It's not that unique, but since that time, since 2009, we've shared the profits. And once again, with all the Obamacare money that came through, it was all the Medi-Cal offices that were getting all these nice big checks to help fund the electronic records. The wealthier side, they didn't mind sharing in those back in the day. It was quite the fight to share before 2008, but we really became a group in 2009 with a unified compensation plan. In 2013, we joined Rady Children's Health Network. In 2008, we became accredited and went on Epic in 2008 and 2009. A lot of things happened that helped us move, but it's only been the last decade and a half that we have this model, and it's paid off handsomely, but it was no guarantee. So it took a lot of work to make sure. There was a lot of speed bumps along the way, and some very unhappy people who thankfully are not here anymore. So we keep the happy ones and let the unhappy.
It must
What's
be
really
the,
like the MBA part of me would say those cost centers that were not doing so well, let them go. That's what they do with systems.
No. We have an office in Southeast San Diego. It's on Euclid Avenue, which is, very low income part of town. It was founded by Dr. Leon Kelly, who's one of my total heroes in life. He's now in his 80s and he had to retire from the group. I love this guy like nobody's business. I still do a lot of social things with him and his spouse. And as he was retiring, he said, "What's going to happen to my office?" I said, "I pledge to you, we will never close this office. We will never, it's 85% Medicaid. I was able to, because we have a unified compensation plan, I can pay people to work there. They make the same. And it is the most magnificent office around. They take the best care of the lowest income patients in the country. They have the best attitude. They have the best of everything." And I made him a pledge. I am never, ever, unless Armageddon hits, we're not going to ever close it because it's not a profit center. We're never doing that. And to this day, we're going to keep that pledge. And sometimes offices don't make a lot of money, but if our system is doing well, we're cool with that. And so my job is to look at the big picture and not micromanage one office having a negative margin. Those kids need us the most. Those are the ones who need us the most. So we don't turn our backs on them. We just don't.
so like good Sam in Long Island, you're very mission driven. You can't lose your shirt at providing care, but if you lose some dollars here or there, in the big scheme, you're so big, it doesn't impact you financially, and you can keep your mission, which is wonderful.
You might have heard of the REACH program. We've had every single one of our clinicians trained on mental health and primary care. I was fought pretty good about, I don't want to do that. What do I want to do that for? But we don't make money on mental health, but we break even. We built our own internal lactation program. The profit margin is like this. We have our own internal healthy weight program, which was a money negative for many years, and now it's a modest profit center. We have an amazing video visit program that I was fought tooth and nail. We don't want to do that stuff. And that is very lucrative for the group because you don't need any staff to run that. And we now have 7-day a week, 365-day a year video visit access for our patients. And wow, a lot of people are not going to the emergency room or the urgent cares because we're open 365 days a year for that. And it took some money to get it started. It was not profitable immediately, but we don't have to make money in a lot of these things. We just have to break even. And that's the general goal of mental health, of lactation, of healthy weight management. Our vision, our group's vision, is to deliver the healthiest children into adulthood humanly possible. And you can't do that if you can't just have physical health. There has to be mental health, there has to be emotional health, there has to be scholastic health. So you have to have it all. And you can't deliver healthy kids into adulthood if all you're doing is giving them shots and checking their ear infections. That doesn't work. So once again, we tend to have not spoiled people. They make pretty good money. They're okay. And they do the stuff that needs to be done to deliver healthy kids to adulthood.
I love what you're saying. I love that thing.
Very, very good. That's a good culture.
And you were in DC. Unfortunately, we weren't able to connect. I was just looking forward to at least giving you one hug.
I took every class I took the ultrasound class, the tooth varishing class, the ophthalmology class, the otoscopy class, the splinting class. I really tried to maintain my clinical skills as best as I can. It's really hard when you only see patients 1 day a week. It's really hard. So I made a commitment to do my best to try to maintain my clinical skills. You have no gravitas within the organization if people think that all you do is sit on a computer all day. I've made a personal commitment to maintain as best clinical skills as I can. I was way better 20 years ago. I attended probably between 4,000 and 5,000 deliveries. I love being in the delivery room. I moonlit at Rady's ER for 20 years in the urgent care. I worked at the receiving home for abused children called Polinsky Center for the foster care kids. I was in the Naval Reserve. I worked like 9 moonlighting jobs. I worked the Children's Hospital Emergency Transport, the ambulance for the critically ill children for 6 years or so after residency to maintain my clinical skills. Pediatricians weren't paid hardly anything back then, so a lot of moonlighting jobs. But my clinical skills is really important to me, and I do my best to try to maintain them.
And you were able to speak at NC. What did you speak about?
Our group had 8 posters and presentations. I had the pleasure of having my name on 2 posters for which I was able to stand around and have people ask questions. But no, I did not give a formal talk. But one of our posters was regarding our integration of mental health in the primary care. The official title was Evaluating Patient Outcomes in a Multi-Center Pediatric Primary Care Behavioral Health Integration Program. We have integrated health therapists that we built into our offices, we do warm handoffs for mental health patients. And the second one was improving clinician wellness by enhancing the care team. So we've embarked on the last few years of primary care team redesign. It's all about teams first. It used to be patients first. Now we've put teams first because you can take the best care of the patients when you have the best teams. We've really been revamping our primary care teams to do the best job regarding clinician wellness. So those are the 2 basic topics. But I just stood there and I just talked. I didn't give any formal presentation.
I thought it was a formal talk. You should have told me you were going to be by the posters. I would have come by and watched.
I stood around, looked pretty, and then left.
And so you go to NCA to stay informed. Do you listen to podcasts or any other way? How do you keep growing both as a physician, as an executive, as a husband, as a runner?
As a husband, I'm not going to touch that with a 10-foot pole, but But my wife still loves me. I can't figure out why she puts up with me. To this day, I cannot figure out why she puts up. But I try and do various levels. I really like to be connected with the world. My favorite magazines are The Week and Atlantic magazines. I try to keep connected there. For the business side of medicine, I did go back. I was the oldest student in my class by 20 years, but I got an MBA a couple of years ago. And it was just at SDSU. It wasn't like Harvard.
Same thing.
But I got an MBA and I really enjoyed being back. But I read Harvard Business Review and I read Health Affairs. And I like it. There's a little throwaway journal called Group Practice Journal by AMGA. It's actually pretty good. And I get a lot of good ideas. For pediatrics, I read Pediatrics Journal and Pediatrics in Review for my clinical stuff. And then I go to conferences. I go to AMGA. AMGA now is way more friendly to primary care than they ever used to be. I go to the Becker's conferences. I love the Beckers. They have the best speaker at the Becker's conferences, and then the AAP. And then I just bounce things off the team. There's all kinds of CMEs at Rady Children's. There's all kinds of luncheon talks that we have and evening talks, and the specialists at Rady's give us talks and stuff. So I have enough to read and listen to. This is the first and probably last time I've had zero social media. I've never listened to a podcast. I've never, Dr. Hunter is very persuasive. She told me you have to do this. I said, okay, I'll do it. But I've never been on Facebook, Instagram, Twitter. I've never been listened to a podcast. I don't do any of that stuff. I just read or go to places, and I'm very old fashioned that way. But if someone's bullying me on Facebook somewhere, I have no idea. So I like it. So that being said, I do mainly print stuff and in-person stuff, not a lot of podcasting stuff. Sorry, but I will start listening to your podcast religiously now.
Oh, I love that. I love that. Well, as you speak, my wheels are turning, and so many people I want you to meet that are.
Believe me, no one wants to meet me.
Oh my goodness, yes. There's so many people that would enjoy to meet your team that are doing different things.
I tell this routinely, and this sincerely, is that I've had maybe 3 original ideas in my whole life. Most of what I have is from, when I was in medical school, one of the professors, one of the clinicians said, it's fine if you steal something from someone to help a patient do better. I don't cheat. I'm not going to cheat on anything. But if you steal an idea of what x-ray to get, or what medicine to give, or what referral to make, if you learn that and someone taught you how to do it, that's fine. I just steal other people's ideas and I put them into place, but I don't have a lot of personal original ideas. I don't think anything we've talked about today, you seem to both mention, oh yeah, other groups are doing this, other groups doing it. There's nothing original about it. It's all comprehensive in one place. So we put it all together, but there's nothing like we're doing that's so different than anybody else in the country.
Well, you're doing it every day, which is what makes a difference.
That's one of the other secret sauces, if we ever get to the secret sauces, is I'm present, and the executive team and the management team is present. We don't take 6-week vacations. We don't just sit in the office, just answering emails all day. We don't just sit in meetings all day. We get out amongst our teams, and everybody here meets their people routinely. And you have to have presence, and you have to be available. If someone wants to speak to me anytime, day, night, it's rare, but I take a little bit of vacations, and I do try to ask them to please at least give me 2 weeks of where I can not have to do it. But if I'm around, there's not a single moment that I don't make myself available if someone needs something. And we've had, like I said, parent deaths, children's deaths. We've had critically ill clinicians. We've had all kinds of someone needs something to be done. You don't have to worry about waking me up or doing anything. We make ourselves available for our people. And I think the teams know that. And they don't call me that much, but when they do, they're never told, what are you bothering me about that for? So what can I do to help? That's all my only response is, what can I do to help? Well, yeah, let me figure out what I can do. And
Yeah. It sounds like a fascinating organization.
Yes. You very much remind me of a restaurant chain here in Northern Virginia, and their management team, which is the owners, do exactly what your management team does. And the CEO and the CFO and the chief, they even have a kitchen where there's a chef that's in charge of everything for these 10 restaurants in different places. They will show up unannounced to one of the stores, they call it, and they will sit down and they will order 2 or 3 dishes and 2 desserts, and they will taste for quality. And it's random. It could be your restaurant today, mine tomorrow, George's the next day. You don't know they're coming, but you know that at some point in the week they're going to stop by and see how things are running. And they're huge on wellness. And this has been 15, 20 years ago. All of their managers, including what they call their managing partner, who is the person in charge of that store, have to go through an intensive psychological assessment and course so that they learn patience, so that when a server asks a stupid question, they don't just bite their head off, but have a good way of teaching that person, how do you take care of the customer? When a customer is angry, they don't react, but they try to resolve the problem for the customer. And that focus on the employee, the management team, and the management team showing up makes their food so consistent and their customer experience so consistent across any one of their stores in any given day, which is what you have been able to achieve.
The general philosophy, and once again, I stole this from somebody else. Take care of the people who take care of you and you'll be well taken care of. That's not an original thought. But the reality is, I just take care of my people. And they take care of me way better than I take care of them. It's a good symbiosis. And maybe that company, I'll be retiring in the near future at some point. I'll go work for them. I don't
Yeah.
think myself. We do have a mandatory retirement at age 70. So I got 7 years to go. And then
From the executive or for the executive and the clinic?
for clinical, and everyone has to see patients. I don't think they want me around too much. I'm in this role for 2 more years, and then I have to figure out what to do for 5 years until I'm 70, and then I'll probably ride into the sunset.
Oh, wow. What have I not asked you that you think is important to share with pediatricians? So our audience is people who are starting up to leaders of really big groups throughout the country. What have I not asked you?
Well, maybe what brings me, joy and doing, and the joy still comes from I go around town and routinely run into somebody that I saw 10, 20, 30. I've been in town 38 years. So I'll see someone and they hung on my word from 30 years ago. I was at the symphony a couple of weeks ago with my wife, and I ran into a nice mother who remembered me. And then she had divorced her first husband. She was with her new boyfriend, but her kids are now 25 and 28. And in front of my wife, your husband, he changed my life. I would not have been able to raise my children without, it was like so over the top. I didn't do anything. Our kids did not have any significant help. I remember the really tough cases, and our kids just were basic, healthy kids. And it was so over the top of how, and my wife does not put up with my praise too much in public. But the reality is, the most joyful thing is knowing that people talk about you around the dinner table when the kids were sick. I want to see Dr. Breslow, or they say stuff like that. Many years ago, I had this mother who had a beautiful 4-year-old girl, and she was in the local emergency room, and she had the ER docs. She said, I wasn't even on call, but she said, you have to come in and see my child. She had a big facial laceration. And she said, I only want you sewing it up. Nobody else can touch it. I go, it's like the most beautiful 4-year-old. You trust me, but just, you need a plastic surgeon on this one, please. And it took me like an hour of figuring out to her. I said, it is the right thing. You have to know your limits on things. The joy is all the relationships that you have with your families, and especially when you see second generation kids, they trust you like nobody's business. The grandparents, I took care of hundreds and hundreds of foster care kids. I had the single largest practice of pediatric HIV in California for a while. They all died, but they were the nicest people in the world. And even with that awful stuff that they had to go through, we treated them with kindness. We treated them with respect, no matter how much other people shunned them. I was the only pediatrician who was willing to go to HIV positive deliveries. You had to dress up back in the day. You thought, oh my God, you're going to die going to delivery. It's like, in a hazmat suit in the delivery room. It was crazy. But I mean, I love the relationships. I love the hospital nurses, the L&D nurses, the NICU nurses. We did our own hospital rounds for decades, the ER staff, the office staff. It's all about the good relationships and then the good relationships with patients and families. And I still get texts to this day of, I'm in medical school now. I mean, when I started, once again, I was in a poverty area of Chula Vista. Maybe 5% of the patients went to college, and most of that was just junior college or community college. I'm getting all these texts with, I just graduated medical school. I just graduated law school. I'm an electrical engineer. That's holy cow. And they give you credit for that. The joy of seeing kids grow up, the joy of seeing parents who value, it's indescribable. And I don't know, I don't understand burnout at all. I reach into it. I just don't get it, because how do you get burned out helping people? How do you get burnt out when they send you stuff like that? I don't get it. I've gotten too much nice stuff in return. So I don't really understand, but I try to help with that. But you can remember the joy, take care of the patients. They remember everything you've said for decades. They'll remember something that you told them. They said, oh, you said my son was going to be good at this, or my son was going to do that, whatever. He was a good athlete. He's now a college scholarship. It's all right. I mean, just some throwaway line that you give, but they remember everything that you tell them. So be careful what you tell people.
Yes. I think part of the burnout is the lack of relationships. So you're very blessed. So is George. They have great wives, and they've been steady, long marriages. I think that's very immunizes you against burnout.
Hope we don't have the
same.
I hope that's
No,
not.
thank God. But also,
Yeah.
but also, I think you must have had partners in your office, in your career, that had your back. And that, I think, is very important. So it goes back to your point, that relationships and people having each other's backs makes a huge difference on the longevity of this career. We are also pleasantly surprised by how many people we meet that have listened to the podcast from all over the country, and they say, thank you. What you said about practicing medicine inspired me to leave a job I hated and start my own practice, and I've never been happier. And as to your point, we're pediatricians. We're not broadcasters. We're not social media people. And we never in our wildest dreams thought that we could help one pediatrician have their dream job, let alone 2, 3, 4, or 5. And that is so rewarding when you see somebody succeed, that your words encourage them to do that. It is one of the most beautiful things about pediatrics.
Amen. I can't add to that.
Yeah.
You have a great voice. Both of you have great voices. My fear of this was, I hate listening to my voice. So I hope when the time comes, we have to listen to this thing, it's going to be torture to me. But you guys, voices for broadcasting.
Your voice is great.
We are recording.
And I hate the sound of my voice too, so we're in good company. Thank you so much. I really do hope that we get to meet. I guess I have to go to La Jolla to buy you and Dr. Hunter dinner.
I was in Arlington, Virginia a couple of days ago. I should have.
I know, but you're so busy.
I'm not that busy, but that being said, you're welcome to come out. If you ever do come out, please. If there are people who would like to talk, I'm happy to. There really are. And I'm more than happy to, if you can give out my email to anybody, or
There's 2 people I want to introduce your team to.
if I can help somebody, or if we're very collaborative. If I can steal an idea from somebody, I'm totally cool with that too. Any of that would be fine with me. But this was a great, I was actually viewing this with quite a bit of trepidation. You two are very easy to talk to.
Thank you.
Thank you for making it easy for me, because I do a lot of public speaking. I've never done anything like this. And this was actually pretty nerve-wracking to me.
Oh, I'm sorry about that. No,
that's my thing. It's not your fault. It's just, I've never done this. So when you try something for the first time, It's just new.
Yes.
You just have to see how it goes. But you guys were particularly easy to talk to and a real pleasure. And you asked questions that I actually knew the answers to, which was awesome.
Well,
Really.
thank you. Thank you so much for your time. Thank you.